Custer, Democrat from New Hampshire in the 2nd Congressional District, and I am the founder and Democratic co-chair of the Bipartisan Opioid Task Force with my colleague, Brian Fitzpatrick. I'm pleased to be joined by so many members of the task force, and we probably will have others coming and going. Thank you, Mr. Joyce. Come on up. But to announce our updated legislative agenda for the 116th Congress. As the nation now knows all too well, this opioid epidemic has torn our communities and families apart. In 2017, more than 47,000 Americans have died in opioid-related drug overdoses. My own state of New Hampshire has been hit especially hard by the opioid epidemic. In 2017, we lost over 400 Granite Staters to an opioid overdose, and synthetic opioids, such as fentanyl, have made efforts to end the crisis all the more challenging. Thankfully, we have a very committed group of nearly 100 members of Congress, bipartisan, working together to address this challenge, and many of our members are joining us here today. I want to especially recognize the work of Congressman David Trone, who could not be with us, but in addition to being a member of our bipartisan opioid task force, Representative Trone has founded the Freshman Working Group on Addiction that is equally bipartisan and has been very involved, and we've tried to work together. So we're grateful for all the new members that are part of this task force as well. As a task force, we're constantly exploring how we can encourage innovative programs in communities throughout the country to combat this public health crisis. And in New Hampshire, we've seen tremendous success at the county and state level, specifically with providing medication-assisted treatment to people both within the criminal justice system and in our communities coping with opioid use disorder. I'm very pleased to announce that my bipartisan bill, the Humane Correctional Health Care Act, is included in the agenda and will receive a hearing next Tuesday in the Energy and Commerce Committee. This bill is designed to improve access to treatment for the justice-involved population and builds upon the success that we've seen in our state. Essentially, one of my aha moments was when I discovered that Medicaid has an exclusion for anyone during incarceration. And so literally the day that someone goes into jail or state prison, they lose their Medicaid coverage. And as a result, for 50 years across this country, people have had inadequate health care, including mental health and substance use treatment during incarceration. And when they come out, we all act shocked that they go back to their addiction. We're not shocked that they go back to their diabetes, but we can end that high recidivism rate that we're all living with, both as taxpayers and in our families and communities, by providing treatment during incarceration. We've demonstrated that you can drop the recidivism from over 50% down to single digits, and people can get back to their communities and working productively. So that's one of the bills. Meanwhile, several of these bills included in this agenda will be before Energy and Commerce next week, and we look forward once again to working with leadership to move these bills forward. Since its founding in 2015, the Bipartisan Opioid Task Force has been an effective driver of legislative solutions to take on the opioid epidemic. From the Comprehensive Addiction and Recovery Act to the Cures Act and the Support Act, we've worked across the aisle to achieve real results in our communities. This updated agenda represents our commitment to helping our communities prevent, treat, recover, and rebuild. And to our members, we have a lot of speakers. Please try and keep your remarks to 1 minute. And with that, I will introduce my vice chair, Representative Brian Fitzpatrick of Pennsylvania. Thank you for joining us.
Thanks, Annie. And thank you to the press for covering this, because this is a big part of our battle here, is to bring awareness to this. We do focus on this task force, as Annie said, close to 100 members, bipartisan. We do focus on opioids, but we broaden that to look at addiction in general and the co-occurring mental health issues that oftentimes coincide with addiction. And there's a broad continuum that we need to focus on from the very beginning, education and prevention, all the way to the backside, treatment and recovery. And we got to focus on all of them. And a big part of what we try to do is to end the stigma. And stigma is a polite way of saying prejudice and discrimination. For far too long, people that have been struggling from addiction, whether it be to opioids or anything else, have been stigmatized. And with that stigma comes brushing it under the carpet, not being open and honest about it, not treating it, not having open conversations with our kids about it. And that's why what we're trying to do is have open, honest conversations about what addiction is, that it's a medical condition that needs to be treated, and we need to have our laws reflect that. This package, 27 bills, seek to address a lot of different pieces to the puzzle, whether it be the prescription drug monitoring program, to the healthcare piece, to the mental health piece, and also to the recovery piece. One of the bills that I've authored that is included in this package, introduced by myself, Andy Custer, and Stephanie Murphy, is the Road to Recovery Act, which deals specifically with the IMD exclusion, which is a barrier for people that are on Medicaid from getting inpatient treatment to treat substance use disorder. So there's a lot of good pieces of legislation. We have a lot of bipartisan support. For the press, thank you for covering it, and please get the word out on it. Thank you.
Super. Sheila, do you want to, as our next most senior?
Let me first of all thank all of the co-chairs of this very important task force and emphasize how unique this task force is that not only has it drawn bipartisan support, but it's drawn cross-regional support. None of us can speak truth if we don't indicate that the opioid crisis of sorts is in all of our communities. As a senior member of the Judiciary Committee, I'm very proud of this agenda with 27 bills, because what it looks to do is what I've been fighting for years, and that is to decriminalize a sickness, an addiction. And our bills are constructively dealing with rebuilding people's lives. I do want to say that a community that we are going to look to work with extensively, and when I say that, legislation that we are looking at, is to ensure that we know that there are teenagers that are opioid addicted. If you know the sports world and young men who have injuries, we want to make sure that they're protected by legislation that we're writing as well. So the cross section of mental health, of banning the box, which would be including arrest or records that you got because of opioid abuse, if you will, and the whole idea of getting people back on their feet is the combination of our agenda. So I'm excited that we're not only bipartisan, but we're wide regional and we're intergenerational, and we recognize that our key element is to heal people, decriminalize, and restore their lives. Thank you very much.
Thank you, Sheila. I want to introduce my co-chair, Democrat Don Norcross.
Thank you. This is one caucus we want to put out of business.
Yes.
Unfortunately, we're one of the largest ones, and when a new member comes in, you can just see on their face there's a reason. And typically it's because somewhere in their life has been touched with someone who has the disease of addiction. But here we are another year, still addressing this chronic and continuing issue that faces all Americans. And let's talk about what it means to the families who've lost someone or to somebody who is struggling. This is a disease, number one. It's not a moral failure, and we need to bring it out of the shadows. And the people we had behind me indicate what it is we're doing. So Brian Fitzpatrick and Annie Custer have been the tip of the spear, bringing us together to stay focused on what's important. The nearly 27 bills that we are talking about today include one that was started by Patrick Kennedy when he served here, that talks about insurance is covering mental health. Yet we still don't have the enforcement mechanism that is needed to make sure that when someone is ready, they have the ability to be treated. And that's incredibly important. But there is a bit of good news. This last year, the first time in almost 2 decades, there's been a dip in the amount of deaths. Now, it's just a dip, and there's still close to 60,000 people a year dying, but it just shows that working together across the lines, we can address this issue. And I just want to thank all of those for participating in this today, because bringing it out of the shadows and having a discussion without hiding it is the first step in addressing those with the disease of addiction. Thank you.
Thank you, Don, for your leadership. Dave Joyce from Ohio, Republican,
Thank you for having me here.
emphasizing the bipartisanship.
I'm proud to be a member of this bipartisan task force. We all know that this opioid crisis does not stop at party lines. From 1999 to 2017, the number of Americans who have died from an overdose of drugs is 7 times the number of Americans who died in Vietnam. Half of the Americans know someone who's been affected by the opioid crisis, but only a quarter of those battling the addiction get the treatment that they need. But it's not all doom and gloom. I've been encouraged by the work we've accomplished across the aisle to help our communities fight back against the opioid crisis. In 2018, drug overdoses decreased for the first time in 28 years, but we can't stop there. The bipartisan legislative agenda unveiled today supports an all-of-the-above approach that includes prevention and education efforts, promotes treatment, provides less addictive alternatives for those suffering from chronic pain, cracks down on illegal distribution, and enhances resources for law enforcement. I've seen this issue draw members from both sides of the aisle together and have full faith that the bipartisan will continue long after this crisis is over. Thank you.
Thank you, Dave. Brad Schneider from Illinois.
Thank you, Annie, and I want to thank the entire task force, Annie and Brian, for their leadership, and Don. This is a critically important issue, and I'm proud to be here to launch the Bipartisan Opioid Task Force 2020 legislative agenda. My colleagues here today, each and every one of us, show that there's a broad bipartisan support for tackling this epidemic. Turning the tide on the opioid crisis requires treating addiction like the disease that it is, and to do that, we need doctors. That's why my bill, the Opioid Workforce Act, is so important. It would create 1,000 additional residency positions over 5 years to hospitals with addiction medicine, addiction psychiatry, and pain management programs. I want to thank my co-leads, Susan Brooks from Indiana, Annie Custer from New Hampshire, and Elise Stefanik from New York. Our bill aims to alleviate the worsening physician shortage, which is anticipated to be as high as 121,000 physicians by 2032, and particularly acute for addiction medicine. Our medical professionals on the front lines of this epidemic are already stretched too thin. This bipartisan legislation aims to educate more physicians equipped with the latest training in addiction medicine and psychiatry to help the estimated 20 million Americans who need substance use treatment get the much-needed care they deserve. Thank you very much.
Thank you, Brian. Lisa Blunt Rochester from Delaware.
Thank you. Thank you, Annie. Good afternoon, everyone. Good afternoon, everyone.
Good afternoon.
I first want to acknowledge the leadership of Annie Custer and Brian Fitzpatrick. This issue, Brian and I actually came in the same class in our first term was last session. And to see Annie Custer just constantly stay vigilant in this issue and make sure that we as a team are approaching this for the American people is inspirational and also should give us hope. This crisis has it's been stated, this is not a partisan crisis that we're dealing with. It's also been stated by Sheila Jackson Lee that it is not just one part of the country. It's not just the city. It's not just the suburbs. It's not just the rural area. It is affecting all of us. And I also want to share that the face of it is not just one race or one age demographic. It is affecting veterans. It is affecting the African American community. It is affecting teenagers, as was mentioned. And so we're all in this together. And sadly, right before I came here, I held a meeting with Delaware's Director of Public Health. And Delaware, as we talked about some of the things that have happened that have become more positive. Sadly for us, the epidemic has gotten worse. CDC's most recent data shows that my home state is second in the nation for drug overdose deaths per capita. Those are people's lives. Those are our neighbors and our friends. We must prioritize improving access to treatment. And that's why I am proud to co-lead H.R. 3927, the PDMP's Help Patients Act, with Mr. McKinley of West Virginia, a bipartisan bill. The bill would create a pilot program for states to integrate a treatment locator tool into their prescription drug monitoring program, or PDMP. With better integration, we can increase access to care and treatment for individuals with substance use disorder. As a member of the Energy and Commerce Committee, I am committed to addressing this issue, and in the coming weeks, I will continue my efforts to provide the robust response this national public health crisis emergency demands. There's a proverb, African proverb, that sticks in a bundle are unbreakable. And what you witness here before you is the fact that individually, maybe you could break our state, but collectively, we are unbreakable. Thank you.
Republican Representative Jim Baird from Indiana. Thank you, Sheila. Thank you, sir, for being with us.
Thank you and good afternoon. As many of you know, the opioid crisis knows no state boundary, no socioeconomic boundary, no age boundary. Opioids have devastated countless communities across the country, and in my home state of Indiana, local communities have been hit hard by opioid addiction. In 2018 alone, we saw 1,626 deaths as a result of overdose. And I've heard numerous stories from families, law enforcement, and personnel in my district that have all been impacted. There are leaders in every community trying to help those suffering. One such leader from my state in Indiana is Indiana Chief Justice Loretta Rice. She is the co-chair of the National Judicial Opioid Task Force, NJOTF, which advocates state courts take a data-driven, holistic approach in combating the opioid crisis. NJOTF aims to bring together all the relevant government agencies, healthcare providers, and addiction experts to better coordinate on how to fight against opioid addiction. Because of Mrs. Rice's efforts, courts have been sharing electronic records with the Department of Veterans Affairs when they have a veteran who is arrested or in jail. This sharing of information enables judges to see the availability of local services that may help our veterans in need rather than incarceration. Veterans are an at-risk population and suffer higher rates of opioid use disorder than the general public. Being a decorated Vietnam War veteran, I understand this all too well. While the VA has made great strides in many areas concerning opioid use disorder, there's still more that can be done. One of my priorities in Congress is to help improve this is by bringing Hoosier common sense to the table. At the Roudebush VA Medical Center in Indianapolis, the primary service provider for veterans in my district, implemented a physical opioid take-back receptacle with incredible results. I've taken that model and crafted legislation H.R. 4817, the VA DROP Act, to ensure that all VA medical facilities are equipped with safe, secure, and continuously available receptacles to dispose of unwanted and unused opioids. I look forward to working with our communities to help combat this challenge to our society. I thank you.
Thank you, sir, for your service. And as you can see, it's not a silver bullet, it's a silver buckshot approach. It's a lot of different issues that we're trying to address. My dear friend and wonderful colleague, Debbie Dingle from Michigan.
Thank you, Annie. And I want to thank Annie Custer and Brian Fitzpatrick for their leadership on this. I'm going to quickly talk about a bill that is on part of this that David McKinley and I have introduced to end pill dumping and bring accountability to suspicious order shipments. I probably know this issue better than most do here. My father was a drug addict, was an opioid drug addict before anybody knew it. And I used to go to that pharmacy and pick up his pills every week. And that pharmacist knew what I didn't. My sister probably became a drug addict in the probably by the time she was 10. There is nothing that I did not experience in trying to get her help, trying to find her, how she got her drugs, how to cut off her drugs, and ultimately she died of a drug overdose. But I was also married to a man who had cancer that had gone to his bones, suffered. Everybody here saw him and knew that he suffered from debilitating pain. And as you get older, you can only take certain pills. So the pharmacist knew who he was. And by the end, I was picking up that Percocet and feeling like a convict almost because of what's happened in this country. This bill is going to give pharmacists the responsibility, the tools that they need to be active partners in addressing how opioids are distributed. And it's going to give the DEA what they need to track unusually large orders. This is a problem in every community, and we got to work together. I know the pain. Thank you.
Thank you. All right. Our colleague Connor Lamb from Pennsylvania.
And I just want to echo all the kind words for our two chairs. Brian, in particular, from my state of Pennsylvania, has been such a great leader and a pragmatist for the whole Congress on this issue. And one of the things we identified when I came to Congress is he and I both served in federal law enforcement around the same time. I as a prosecutor, Brian as an FBI agent. And one of the roadblocks we constantly ran into in these types of cases was that for fentanyl in particular, the officers at the scene of a drug bust could not tell from eye or smell or any other form of detection the difference between fentanyl and heroin, which is extremely dangerous to them. And while I was at the U.S. Attorney's Office in Pittsburgh, we actually had a group of more than a dozen police officers break down a door and become immediately exposed to a huge cloud of fentanyl that sent them all to the emergency room. It's that powerful, and it's that much more powerful than heroin. And the problem on the prosecutorial side is that you can actually put forward much stronger charges with stronger penalties for a smaller quantity of fentanyl than you can for heroin. But you need to know that right away. You need to know at the time of the drug bust, or else you can't put in the charges. It's harder to get cooperation. And so the bill that we've included in this package called the Power Act does one simple but very effective thing, which is get detection equipment in the hands of law enforcement to tell the difference between fentanyl and other opioids, which doesn't exist in a lot of police departments today and in a lot of crime labs. And so it could take us 6 months or a year at times to even know if we were dealing with a fentanyl dealer. But given how easily that stuff can kill every single user, every single police officer who's exposed to it, you have to know that day. You have to know right away, because every law enforcement department all over this country has scarce resources, and they need to prioritize the most dangerous dealers and the most serious investigations. So I want to thank also Sherrod Brown in the Senate, who's been the leader of this legislation over there and brought me on board, and we're going to do everything we can to get it through. Thank you.
You can get a sense of the broad range of experience that our colleagues have as well coming to this issue. Our last speaker, Mary Gay Scanlon from Pennsylvania. I want to thank Jimmy Panetta, who also showed up from California.
Thank you very much to my friends and colleagues, Representative Custer and Representative Fitzpatrick, for leading this bipartisan task force. Coming here from Pennsylvania, there was no question that I had to get involved in this task force. It's no accident that we have so many members from Pennsylvania bringing their experiences to the table here. The impact of the opioid crisis in our region has been huge. We're losing 4 people a day in the Philadelphia region to this crisis. So I'm proud to be a member of the task force and really excited about this broad package of prevention, treatment, and other measures to address what's going on with substance abuse disorder in our region. I come to this from a slightly different angle. I was a child advocate for many years before coming to Congress. So in recent years, I had a subspecialty in helping grandparents get custody of their grandchildren because the parents were unavailable due to substance use disorder. taking care of these children out of love, but running into challenges. How do you stretch a retirement budget to incorporate raising a young child? How do you get services that a child may need if they've been a victim of abuse or neglect because of the parent's disorder? So we need to do a better job helping grandparents and other relatives who are raising children in kinship care situations. So earlier this year, I introduced the Bipartisan and Bicameral Help Grand Families Prevent Child Abuse Act with my colleague from Pennsylvania, Republican Representative Glenn Thompson, to provide more support to grandparents and other kinship caregivers who've taken over responsibility as primary caregivers for children exposed to substance misuse. So I'm very excited that we can try to also, in addition to addressing prevention, treatment, and law enforcement, that this agenda by the task force includes measures to address the ripple effects in our region of substance abuse disorder. So thank you again for allowing me to be here, and I look forward to working with my colleagues as we move forward. Thank you.
And that's a great way to wrap up. So